Skills for Lifestyle Support Part 3 Nursing Care Related to Elimination Needs. First chapter is Significance and Aim of Excretion. Section 1 Significance and Aim of Excretion. 1. Significance and Aim of Excretion. There are 4 points. 1. Excretion is an essential mechanism of the human body to stay healthy. 2. It is the most private behavior. 3. Excreted urine and feces show the state of health. 4. Based on the user's bodily function, a caregiver does a proper way of excretion care. Excretion serves to remove waste product from the body. The waste product include urine, feces, sweat, carbon dioxide, etc. Second chapter is Mechanism of Excretion. There are 5 sections. 1. Mechanism of urination. 2. Mechanism of defecation. 3. Posture during defecation. 4. Appearance and amount of urine. 5. Appearance and amount of feces. 1. Mechanism of urination. The urine is formed in the kidney, then stored in the urinary bladder, and finally excreted through the urethra, which is called urination. The urinary system is responsible for removing waste from the body. Centers involved in the control of urination are in the cerebrum, brainstem, and spinal cord. Kidney filter your blood, removing waste and extra water to make urine. Renal pelvis collects urine. Ureters are tubes that propel urine from the kidney to the urinary bladder. Urinary bladder stores urine, allowing urination to be controlled. It has a capacity of about 500 ml. Urethra is the passageway between the bladder and the external part of the body. When a volume of 200 to 300 ml urine is in the urinary bladder, the individual feels the need to go to the toilet, which is called the urination urge. 2. Mechanism of defecation. The food and liquid consumed orally are transferred from the mouth to the stomach, where the digestion begins. The food and liquid then move to small intestine, where the nutrient and water are absorbed. The waste product remaining after absorption becomes feces and are expelled from the body. This is called defecation. When the feces accumulates in the intestine of an individual, he or she feels the need to go to the toilet, which is called the defecation urge. The urge disappears as time passes. 3. Posture during defecation. The ideal posture is 1. Lean slightly forward. 2. Heels up. The posture makes it easy for the feces to pass through because the path from the rectum to the anus that exists for the feces is set straight. 4. Appearance and amount of urine. The volume and frequency of urination are affected by the environment and diseases. Please see the chart of normal and abnormal urine. Amount: normal 1000 to 1500 ml per day. Abnormal 2000 to 3000 ml per day or 300 to 500 ml per day. Frequency: normal 4 to 5 times per day. Abnormal 10 times more per day. Odor: normal, odorless. abnormal, ammonia. Color, normal, light yellow, transparent. Abnormal, cloudy, dark brown. Kind of urinary incontinence. Urinary incontinence refers to the involuntary leakage of urine. Stress urinary incontinence. Urinary leakage due to coughing, sneezing, etc., causing abdominal pressure. Urge incontinence. The individual gets the feeling of wanting to pass urine, but can't hold it and suffers urinary leakage before getting to the toilet. Overflow incontinence. Minor urinary leakage occurs because the urinary tract gets closed and weak bladder muscle. Reflex incontinence. Leakage of urine occurs due to spinal cord injury, etc. Functional incontinence. For one or more physical or mental problems like dementia, the individual is unable to get to a bathroom. 5. Appearance and amount of feces. Defecation is affected by the consumed food, disease, etc. Therefore, the shape, color, and frequency change depending on the situation. When you provide nursing care, you need to know the state of the normal defecation of the user. Please see the chart of normal and abnormal feces. Frequency, normal, 1 to 2 times per day. Abnormal, infrequent, constipation. Color, normal, brown, abnormal, red, black, white. Kind of the constipation. Constipation refers to a state in which the frequency of bowel movement and the volume of feces are continuously lower than usual. Functional constipation. Constipation caused by bodily functions. Organic constipation. Constipation that occurs when the path of feces is blocked due to tumor and inflammation. Third chapter is Basics of Nursing Care related to elimination needs. There are 4 sections. 1. Point to remember regarding nursing care related to elimination needs. 2. Independent support regarding excretion. 3. Prevention of constipation. 4. Treatment of diarrhea. 1. Point to remember regarding nursing care related to elimination needs. There are 5 points. 1. Stick to the user's excretion routine. 2. Be considerate of the embarrassment the user feels. 3. Pay attention to the odor. 4. Choose the appropriate method and tools for excretion. 5. Prevention of infectious diseases. 2. Independent support for excretion care. If a user can walk, he or she goes to the toilet. 2. If a user can sit, he or she goes to the toilet or use the portable toilet or the commode. 3. If a user is bedridden and doesn't have any desire to excrete, he or she uses a diaper, but caregivers should think how he or she can do excretion care comfortably without a diaper. 3. Prevention of constipation. 1. Make it a habit of the user to go to the bathroom regularly. 2. Have the user regularly drink an adequate amount of water. 3. Include a good amount of dietary fiber in the user's diet. 4. Include exercise in the user's daily life. 5. Abdominal massage. 4. Treatment of diarrhea. Diarrhea refers to loose or watery feces. Regarding treatment of diarrhea, there are 4 points. 1. To prevent dehydration, because the water gets lost from the body. 2. To have the user drink warm water or normal temperature sports drinks. 3. To wipe or wash off to keep the skin around anus clean, because the water feces can irritate the skin around the anus. 4. To report medical staff in the case of an acute diarrhea. Excretion is affected by psychological stress. Carefully assess the condition of the user and listen to user's complaint. Attentively observe the state of the excreted urine and feces. Fourth chapter is Actuality of nursing care related to elimination needs. There are 2 sections. 1. Nursing care in the toilet. 2. Nursing care related to diaper change. 1. Nursing care in the toilet. Example of the environment for excretion. L-shaped handrail. It is for user at the time of standing up. Adjustable handrail. The handrail goes up and down to suit the condition of the user. Call button. The user can call the caregiver when he or she is in trouble or is done with toilet. Sliding door. A sliding door is easy to open even for wheelchair user. Safety check, room temperature check. Have the user hold the handrail. Maintain the balance of standing position. For the user with hemiplegia, the caregiver should be at the user's affected side to maintain stability. Pull down the user's pants and underwear. The caregiver wait outside to respect privacy. Before going out, confirm that the user is maintaining a stable sitting position. Pull up the user's pants and underpants. After the user signals that he is done, the caregiver goes into the bathroom and pull up the user's pants and underpants. But if the user's standing position is stable, have him pull up the pants and underpants by himself because of supporting independence. Record the condition and the amount of excrement. 2. Nursing care related to diaper change. Check room temperature. Adjust room temperature at 25 degrees. Respect privacy. The door should be closed to respect users' privacy. Preparation for necessary supplies. Pad, disposable glove, bottle shower with warm water, wet tissue, etc. Greeting, explaining, and obtaining consent. Greeting and explain to the user the purpose and the content of your actions and obtain consent from the user. Adjust the height of the bed to prevent the lower back pain. Warm your hands and put on gloves. Clean the genital area. Peel the tapes of diaper off, then clean the genital area with warm water using a bottle shower. The water temperature should be about the same as the body temperature. For female users, wash and wipe from the urethra to the anus to prevent infection. Clean the area thoroughly, even where the skin is holded. Place the user in the lateral position. Clean the buttocks. Check if there are bed sore or skin rashes. Pull out the pad. Roll up the soiled pad. Hold the soiled surface of the pad inward. Check the condition of the excrement. Put the new pad. Turn the user back to the supine position. Put on the diaper. Stick the tape with enough room to allow a few fingers to be placed in the abdominal and femoral regions. Don't tape firmly on the diaper, or strong pressure causes itching. Tidy the clothes and bed sheets. Wrinkled clothes and sheets can cause discomfort and pressure ulcers. Ventilate the room. Record the condition and the amount of excrement. Fifth chapter is tools used in providing nursing care related to elimination needs. There are 3 sections. 1. Portable toilet. 2. Urinary collector, bedpan. 3. Diaper, incontinence pad. 1. Portable toilet commode. A portable toilet is used by those who feel the urge to urinate or defecate but unable to go to the bathroom, and for nighttime toilet use. 2. Portable urine bottle, bedpan. These tools are used by those who feel the urge but are bedridden, are in poor physical condition, and have difficulty in maintaining a sitting position. Toileting using a urinary bottle. Male. Place the user in the lateral position. Place a pillow, etc. at the back, and put the urine bottle in place. Female. Guide the urine into the urine bottle with a tissue paper, etc., so that the urine will not splash. 3. Diaper, incontinence pad. For those who are not aware of urination or defecation, and those who have difficulty in using a portable toilet, etc. Okay, you are done with nursing care related to elimination needs in the category of skills for lifestyle support. Congratulations! You can get one step closer to be a good caregiver. See you next lesson.